Good morning. Thank you very much for waiting. Before we begin this morning, I want to say a few words about the situation that just happened in our neighboring community of Cedar Hill. Yesterday afternoon, there was a shooting that occurred at a medical facility, and it was one of a couple of shootings that happened in the Dallas Metroplex. This one hit a little close to home. Uh, it was at the medical clinic to where my personal care p- position is. And from reports that I have received, he was the person that was shot at. So I would like to offer our prayers this morning for a quick and speedy recovery to the doctor. Um, our prayers are with you, and also to everyone involved in this. And it goes to the staff at this medical care facility, which does a phenomenal job in taking care of the patients. I've been going to that facility for 20 plus years, and I can tell you that they're second to none. So let's please give our prayers to everyone involved in this yesterday. They surely do need it. This morning, I do want to talk to you about um, additional steps that we can take on the agenda of mental health. And I just came from a uh, minister's breakfast here locally, where one of the sidebar discussions was mental health, and I posed the question, using yesterday as an example: how are we going to get the people who need the help? How are we going to get them help? And this was shown to me a brochure. Well, that's all fine and good, but we've got to get the person there. You legally cannot force the person for mental help, and that was even admitted this morning. That can't be done. There's got to be a way that we can get the people who need help, so we avoid the situations that happened yesterday in a neighboring community. Today, my administration is announcing additional critical actions to advance my mental health agenda. This mental health strategy will have three key objectives: strengthening the mental health workforce and system capacity, connecting more Americans to care. A good example is right here. In creating a team of support. Addressing the mental health crisis requires that we confront the severe shortage of mental health professionals and strengthen the capacity of the behavioral healthcare system. As a result, this administration is taking the following actions. We will increase the size and diversity of the behavioral health that the, that the Department of Education, and it has awarded this year more than $280 million in funding to bolster that pipeline of mental health professionals serving in schools and expanded school-based mental health services and supports. I'm well connected with education, and that's one of the key things that the schools really need help on. It's the necessary mental health support for our students. They're coming off a pandemic. A lot of them are having a hard time readjusting uh, back to being in school. I could say that's probably not that's not a big thing, but it's still out there. We got to have the support available for them. This program will help that. Early this year, the Education Department announced a $95 million um, of grants across 35 states to increase access to school-based mental health services and strengthen the pipeline of mental health professionals in high needs school districts, such as Title I schools, such as the low income. and across the board, everybody needs this mental health, and I want to ensure that this program has the necessary funds to make that happen. Grantees from the Mental Health Programs Project that use funds will create more than 14,000 new mental health professionals in U.S. schools. Think about that, 14,000 additional jobs in schools, including school psychologists, counselors, social workers. And I've often talked about my education agenda, about how I do want to pay our educators a livable wage. Nursing in schools, it's the same issue. Nurses are leaving our schools, going to other fields of practice and making more money. It's time that we pay our school nurses, along with our teachers, a livable wage. This month, the Education Department also announced new funding for a center that will provide technical assistance to grantees working to address the critical need in pre-kindergarten to 12 schools, K through 12 schools, for school-based mental health service providers. Earlier this summer, we've also announced a new behavioral health workforce education and training funding opportunity for approximately $8.4 million to support 16 awards to recruit and train providers to provide behavioral support to children and the adolescents. We need to expand our access to peer support. A peer worker, do we all know what a peer worker is? Is someone with lived experience with a mental health and or substance use condition, and who works with other people with similar conditions in a wide range of non-clinical activities. Now, that could be a person who is, just for example, a recovering alcoholic, somebody who's getting over a mental health crisis, somebody who's been there, done that, understands the struggles, and can help that person get to where they need to be. This program will help that. And it will provide funding for people with similar conditions in a wide range of non-clinical activities, including advocacy, navigation, and linkage to resources, sharing of experience, social support, and more. In the coming weeks, the administration will also outline the Substance Abuse and Mental Health Services Administration. They will release a national model standards for peer support certification. So there'll be a certification program that you will have to go through in order to be that peer support person. To improve the consistency across peer certifications and promote equality of the growth number of peer workers across the nation. Another thing that we're going to work on in the final part of this program is enhancing crisis response to ensure those in crisis have access to services, just like I was talking about right here. Access to services. Now think about this. Think about this. What if the person yesterday that was part of the shooting up the road, what if he had access to help? What if he had somebody to talk to help? We wouldn't be here this morning talking about a shooting just down the road. Access crisis response to ensure those in crisis have access to the services, like I mentioned. We'll also announce the availability of more than $200 million for states, territories, call centers, and tribal organizations to continuing strengthening the 988 operations. Throughout the supported 988 Suicide and Crisis Lifeline, the network receives 100,000 calls, chats, and texts each week. Think about that. 100,000 calls, chats, and texts each week. Yesterday, that person who did that could have been one of those 100,000 people if we got him help. We'll also announce more than $9 million in awards and cooperative agreements for community crisis response partnerships. This funding will support mobile crisis response teams to ensure adults and youth experiencing mental health crisis in high need communities receive faster access to trained mental health professionals. And I've seen that played out several times whenever there is an active shooter event, especially when you're dealing with a school situation. There's always counselors deployed there to help out not only the students, but the staff and everybody involved. You know, we've outlined the steps this morning that this administration is going to take, and we can throw money at it. We can throw the entire federal government budget at it if we wanted to, but throwing money at it won't solve the problem. Having the tools available to get the people help will be a great start to this and can get this under control. Again, imagine if the person involved in yesterday had those tools. And I've said many times that it takes a lot. It takes a lot for a person to shoot a weapon. And imagine if he was able to call and get some help and have somebody to talk to him. We wouldn't be talking about that this morning. So, in closing, I just want to say that my administration is going to be fully supportive of mental health funding. I think that's something that drastically this nation needs, especially coming out the pandemic where it was such a crisis and such a stress on the American people. It's something that we really need to continue funding, and I will do everything. My administration will do everything in its power that it can to see that this does continue and the people who need the help get the help. I want to thank you all very much. Thank you.